Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we talked about the key features of psychotic disorders. In this video, we're going to discuss delusional disorder, so let's begin. In order to get diagnosed with delusional disorder, the individual has to 1. Have at least one or more delusions that present for at least a month or longer. Number 2, the individual has been assessed for schizophrenia and does not show the criteria for it. Number 3, there is not any extremely abnormal behavior that's being viewed besides the delusions or delusion. And number 4, if the individual has major depression or manic episodes, these episodes do not last as long as the delusions do. Number 5, the delusions did not come from a different mental illness. When diagnosing delusion disorder, it is important to specify which type of delusion or delusions the person is experiencing. Erotomanic delusions are those in which the individual believes someone is in love with them, even though it's clear that they're not. Grandiose delusions are those in which the person believes they have a unique talent or have made some important one-of-a-kind discovery. Number 3 are jealous delusions. These are ones in which individuals believe their spouse or partner has been unfaithful when they have not been. Persecutory delusions are those in which the person believes someone or a group of people is after them, or that they're being spied on, cheated on, poisoned, drugged, or harassed by someone, even though it's not true. Number 5, somatic type, is the belief that one's body is not running correctly, but everything is fine with their body. Mixed delusions are when no particular delusion dominates the person's thinking, but many different delusions are present. And then unspecified delusions are when a dominant delusion cannot be figured out, or there is not a specific type that can be reported. The diagnostician will also want to specify if the delusions are bizarre or could not really happen within normal everyday life. An example of a bizarre delusion might be believing that someone has stolen one of your kidneys, even though x-rays show both kidneys are intact and there are no surgery marks on your body. If the individual has had the disorder for more than 1 year, these specifiers are to be used. Specify the first episode. If they are currently in an acute episode means when they are first diagnosed with the disorder given full criteria. Are they in that acute episode? Or 2, first episode in partial remission. And that's when you see improvement has been made and maintained. When they're still kind of working outside of that. Number 3 is first episode, but currently in full remission, when the symptoms were there, but there's no longer a belief in them that is not present anymore. And then multiple episodes can be happening and can also be in acute episodes, meaning they are all present at the moment and they're being believed. There's also multiple episodes with partial remission, meaning that they're kind of moving out of them. And then continuous symptoms fulfilling the diagnostic symptom criteria of the disorder, but they remain for the majority of the illness course. The severity of the certain key factors will also need to be rated. So if you remember, the key factors are delusions, disorganized speech, hallucinations, negative symptoms, and abnormal psychomotor behavior. These will need to be categorized for their severity. So we tend to use a 5-point scale, and 0 represents not present, and then 4 to 5 indicates that the symptoms are present and they're very severe. So each one of those will need to be rated. The DSM-V provides a bit more information about the different types of delusions. Now, with erotomanic delusions, when that person believes that someone else is in love with them, usually that person will have a higher status from them. And a lot of the times it's going to be a person that's at work. This individual will probably make it known to the person that they believe them to be in love with them. With grandiose delusions, if the individual does not state that they have extraordinary powers or that they've made this important discovery, they may believe that they have a special relationship with somebody who's famous or has made an important discovery or a friendship with a person who has special powers. These delusions can also be religious. They can believe themselves to have a special relationship with a religious figure that other people do not have. Those individuals that have jealous delusions think their partner is unfaithful with them, but they will try to get like small bits of information that tend to fit that notion, but they're not enough to really believe that that is happening. The individual will usually confront the spouse or the partner in an attempt to intervene, kind of like this imagined infidelity. In persecutory types, this is when a person believes that they're being spied on, followed, poisoned, harassed, maliciously maligned, and they may go and seek legal assistance to get the people to stop. The weird thing is there's no proof that this is actually happening. So they're often resentful and angry and may resort to violence against those who they believe are hurting them, even though they're not. In a somatic type, it can be really severe. If it's severe, a lot of the times the people believe that their body is giving off a really foul or nasty odor, even though it's not. They might believe that they have like some sort of internal parasite that's eating away at their body, but that, again, there's no evidence of it. Or they may think that their body is very ugly or misshapen in some way, or that their organs are not functioning properly. The main part of delusion disorder is the presence of one or more delusions that persist for at least 1 month. The diagnosis for this disorder should not be given if they fit the criteria for schizophrenia. In that case, you'd be looking more under the criteria of schizophrenia. Well, this is the end of our video concerning delusion disorder. I hope you enjoyed the video, and please click that like button if you did, and don't forget to subscribe. I want to make a note that I put in the borderline personality disorder in because I was having some people ask for it. It is not part of delusions. It is not part of psychotic disorders, but I just wanted to kind of make that note there. I hope you have an amazing day, and I will talk with you soon.